Welcome to the National Library of Medicine informational webinar. NLM is the world's largest medical library. Its programs range from consumer health information to medical literature to genetic data in support of the Human Genome Project. NLM is located on the campus of the National Institutes of Health in Bethesda, Maryland, and the National Institutes of Health is the nation's medical research agency supporting scientific studies that turn discovery into health. Today, you'll hear information about an exciting career opportunity for Chief of the National Network Office, as well as an overview of the application process and how to navigate the federal application system USAJOBS. Additionally, we will respond to some frequently asked questions. Now, let's meet your presenters. My name is Melody Ng, and I am a part of the Corporate Recruitment Unit in the Office of Human Resources. You will also be hearing from Joyce Backus, Associate Director for Library Services at the National Library of Medicine. Ms. Backus has served a number of key positions of increasing importance and responsibility, culminating most recently with her appointment as the Associate Director of Library Operations in 2013. Later on, you will be hearing from David Wittenberg, a Human Resources Specialist at the National Institutes of Health. Please welcome Joyce Backus.
I'm pleased to talk to you today about the National Network Coordinating Office and the programs that they bring to researchers, practitioners, and librarians throughout the United States. The history of the National Network of Libraries of Medicine goes back to 1965, when President Johnson signed the Medical Library Assistance Act. At that time, Congress decided that it was important for there to be an organization who could improve access to health information to U.S. health professionals throughout the country, and since that time, the network has endeavored towards that goal. Although the program is decades old, in the most recent iteration, we made several changes based on feedback from those who were delivering the program and also those who were receiving their services. For the 2016 to 2021 program, the Regional Medical Library Program is now a cooperative agreement, or NIH grant, and it has a National Network Steering Committee, which is something that didn't really exist before. This steering committee is a partnership amongst the Regional Medical Library PIs and also our National Network Coordinating Office here. The National Network Coordinating Office head is both a member of the National Network Steering Committee and the head of the office of the project scientist coordinating the program. Within the National Network of Libraries of Medicine, there are 8 regional medical libraries, each located at a university in geographically specific areas. These RMLs also house 5 coordinating offices which focus on one aspect of the program: training, evaluation, web services, DocLine, and public health. Members of this network that are coordinated by the 8 regional medical libraries include hospital libraries, academic libraries, resource libraries, and public libraries, all of whom help us to bring NLM and other information resources to practitioners. The network serves healthcare professionals, practitioners at hospitals, universities, clinics, those administrators. It serves researchers in universities. It serves historians who may be anywhere in the country. It serves students from K-12 to college to graduate students. The network also serves educators. And very importantly, the network serves the public, patients and families who need health information. And lastly, the network is meant to serve information professionals and to make them a stronger workforce to be able to serve all the other user communities that you see above. A major program of the National Network is to give awards to organizations in their regions who can help bring health information to a variety of communities. In this map, you can see where the funds for these awards went in the last contract cycle of 2011 to 2016. These subawards engage in outreach in a variety of communities and a variety of purposes and the variety of audiences that I mentioned earlier. They vary from emergency preparedness to bringing National Library of Medicine information products to professional exhibits, to health literacy projects involved with community-based organizations, and also professional development for librarians and information professionals, including Science Boot Camp. This network is all coordinated with the National Network Steering Committee. This steering committee provides guidance and transparency among the 8 regional medical libraries and offices to ensure that the work that they do is based on evaluation and outcomes. The head of this office is a member of this committee and works to coordinate with the National Network Steering Committee to be sure that the program stays in tune with the goals of the National Library of Medicine and NIH. We look forward to you considering applying for this position.
Thank you, Joyce, for that great overview. Now that you've learned a little bit more about the position, let's talk about how you can apply. USAJOBS is the official job site for the U.S. federal government and is operated by the U.S. Office of Personnel Management, also known as OPM. Most federal civilian jobs are posted on USAJOBS. Here's a sample of what a job announcement looks like. Make sure you read the job announcement carefully. We recommend that you print out the job announcement so that you can refer to it as you complete your application. The job announcement tells you valuable information about the position, including opening and closing dates, salary range, a job summary, duties, and required documents. Make sure your application is complete and submitted before the closing date. If you'd like to make any edits to your application after you submitted it, you can, as long as it's before the closing date. Now let's move on to the assessment questions, which can be found under the How to Apply section of the job announcement. This tends to be the section that many candidates struggle with. It's also a critical component of your application. Your responses will play a key role in the human resource specialist's evaluation, determining if you are highly qualified, minimally qualified, or not qualified for this position. Be sure that your responses are reflected in the experience section of your resume. Notice that the answers range from response A, no training or education, to response E, I am considered an expert. Just remember to be honest, not modest, and be sure that your resume supports the rating you select. So once you've submitted your application, you may be wondering what comes next. Typically, a series of system-generated responses are delivered to the email address you registered with your USAJOBS account, but this may depend on your account notification settings. You can always log into your USAJOBS account and visit the Application Status tab area to see the status of your online application. Here are some examples of the statuses you may see on your USAJOBS application status page, as well as what they mean. If you have any other questions about your application status, USAJOBS has frequently asked questions, tutorials, and other help resource pages that you can refer to. You can also contact the HR specialist if it is listed on the announcement. As a reminder, please be patient as it may take several weeks after the closing of an announcement before you receive a status email. Now let's welcome David Wittenberg, an NIH Human Resource Specialist who will answer some frequently asked questions. I've heard that federal resumes are different than academic CVs or private sector resumes. How are they different?
Federal resumes are often much more lengthy in order to include details describing an applicant's qualifying specialized experience for each specific job and time period. Federal resumes are focused on the day-to-day accomplishments for each position and are used in determining qualifications for an applicant, while private sector resumes generally are brief and include general employment and skill-based information. Academic CVs are often lengthy and focused on publications, education, and areas of study, but are generally skills-based rather than formatted to include detailed qualifying experience for each specific job and time period. An initial qualification determination may not be able to be supported if this information is not included in your federal resume and cover sheet. The federal resume and cover sheet, along with the personal assessment questions, which applicants answer for each vacancy, are reviewed to determine the applicant's initial qualifications for a position. If initially qualified and referred, the hiring manager will review the resume and cover sheet for interviewing decisions. The federal resume and cover sheet provide detailed information regarding an applicant's specific qualifications for each position. Each federal vacancy announcement on USAJOBS includes examples of specialized experience for the position. These types of experiences should be addressed in the resume and tied to a specific job and time period. An initial qualification determination may not be able to be supported if this information is not included in your federal resume and cover sheet.
Should I include additional documents like letters of recommendation with my application?
It's not necessary to include any additional documents which are not specifically requested in the vacancy announcement, but applicants may choose to include additional supporting documents if they desire.
Can you explain what expert means in the assessment questions?
The term expert is used to show a high degree of expertise related to that specific question. While self-certifying expertise can be subjective, it is important to be truthful without being overly modest. Just make sure that your resume contains quantifiable experience that backs up your answers to the assessment questions.
Will I need a security clearance for this position?
These positions are considered public trust positions which require a high degree of integrity with public confidence, which will entail a higher level background check. All federal employees, including the selectees for these positions, will undergo a background check in order to determine suitability for federal employment, but a security clearance is not required. Supervisory librarian positions do have a specific education requirement. Applicants must possess professional education in library science, which includes either A, completion of at least one full academic year of graduate study in library science in an accredited college or university, in addition to completion of all work required for a bachelor degree in any field, or B, a total of at least 5 years of combined college-level education, training, and experience. The educational requirements will be listed on all vacancy announcements.
What does the pay range mean? Will I be offered the highest dollar amount or the lowest? And how is that determined?
Federal law requires initial pay offers at the lowest dollar amount of the pay scale. NLM may consider matching candidates' current pay based on superior qualifications of the candidate, but cannot go over the pay scale.
How long will it take me to be called for an interview?
Applicants will receive status updates through USA Staffing regarding referral status. The referral list is provided to the hiring manager 2 weeks after the vacancy closes. The hiring manager will decide who is interviewed within 90 days of receiving the referral list.
I've heard that veterans get preference for federal jobs. What does this mean and how does it apply here?
If a veteran applies and is rated as a best qualified candidate, they will receive preference. Should this occur, non-veteran qualified applicants cannot be referred, unless the veteran declines or withdraws from consideration. Applicants will be notified via USA Staffing that they are qualified and have not been referred.
Thanks, David, and thank you all for joining us. Best of luck!